So the vision of our research is that when we talk about food prices, the concept measured should reflect the food that people need for active and healthy lives. Going along with the concept of food security that has been the globally agreed concept for the last 20 years, of food security being that all people at all times have physical and economic access to sufficient, safe, nutritious food to meet dietary needs and food preferences for an active and healthy life. So this concept of access to adequate food is central to what agriculture and nutrition linkages can be. And the reason that we're working on food prices, it's because it has a lot to do with food access. And usually, food prices as they're currently measured either reflect actually starchy staples, as in the World Food Programme's monitoring of starchy staples that they report regularly in the Market Monitor, or a basket of foods based on economic importance. So an example of that is the FAO Food Price Index, which includes only the commodities of sugar, cereals, meat, dairy, and vegetable oils, certainly not created to reflect a nutritious diet. So food prices, as you hear it, in the news, when you think about that term, it doesn't actually mean the price of foods that human beings need to have adequate nutrition or to thrive. And so you may be wondering why this is in the dietary transition session. Well, it's because of this key pathway between agriculture and nutrition. There are many pathways from agriculture to nutrition, but one that many programs and policies seek to work on is this pathway from agriculture to food access, again, meeting nutritious food to meet dietary needs, and then leading to improved diet quality, and then leading to improved nutrition. So indicators in these key areas between agriculture and nutrition are inadequate or missing. And so if we want to understand dietary transitions, we need to also understand food access and the food environments that are affecting how people spend their income to attain adequate diets. And I would like to just call your attention to the food environment brief, which is in your folders, which goes into this in detail, all the aspects of the food environment, which have much to do with food access, and food prices and affordability are a key part of the food environment affecting diet quality. So what's needed are food prices that reflect nutritious diets. Agriculture and food systems can make nutritious diets more available and affordable, but governments and projects don't have functioning information systems that track the prices of nutritious foods. So our goal with IANDA is to use existing food price data systems better to understand availability and prices of nutritious foods. And that's a key part of this project, is not to set up a new data collection system, but to use the systems already there to provide better information for nutrition. So we are working in Ghana and Tanzania as a kind of proof of concept. It's been really informative to work in two different countries. Ideally, these indicators that we've developed could be used in any context. But I will go through what we've learned in Ghana and Tanzania. The key sources of our food price data, after we looked at many different options for food price data, ended up being two sources in each country, one being a national statistical office, Ghana Statistical Service, and Tanzania National Bureau of Statistics that collect consumer prices. The others are, the other two collect agricultural market prices, the Ministry of Food and Agriculture in Ghana and the Ministry of Industry, Trade and Innovation in Tanzania. So we selected these key data sources of food prices because they're run by national government organizations. They have a mandate to provide public data on food prices. They have nationwide operation, which makes it possible to compare prices across different regions and across different seasons because they have a system that regularly collects these prices. And they also had adequate diversity in their food lists of the prices they do collect. And that's critical to be able to understand nutritious diets. We also had worked with some other sources that had only staple grains or only horticultural products, and from those sources you couldn't get a full picture of the price of a nutritious diet. Ministry of Food and Agriculture in Ghana actually didn't have quite a diverse enough list when we started. So we worked with them to actually look at their food list that they collect weekly in 164 markets nationwide. And we added some foods that are highly consumed and very nutritious in Ghana. So for example, their list did not include any green leafy vegetables. And we worked with nutritionists in the country to determine the most commonly consumed ones. And then we worked with the Ministry of Food and Agriculture to pilot an expanded food list, including those and some other nutrient-rich foods. And the ministry decided to actually institutionalize the expanded food list nationwide and continue collecting data on the more diverse food list. And from their point of view, this was really beneficial because they, just the simple availability of data of more diverse foods helped them when businesses or farmers come to them for food price information to understand the market flows and where there are opportunities for investing in growing certain foods. The new data on different kinds of foods provides information that simply wasn't there before. So it sort of is a tool, having a more diverse food list for monitoring is a tool to improve agricultural diversification because it makes the foods that had been missing, now they are no longer invisible to stakeholders that would like to invest in agriculture. So they were very, really great partners to work with in this project. And we developed 4 different indicators from the diverse food list data. 2 of them are indexes that track changes in price over time, but not the absolute cost of a nutritious diet. And then 2 of them can show you actually what it would cost out of pocket to purchase and complete adequate diet. So I'll go through these briefly. For the indexes, the first one we developed is a nutritious food price index. It takes the concept of a food consumer price index, which countries regularly compile and report. The consumer price index weights items by actual expenditures. So it weights items by economic importance, how much people actually spend on them. We took the same food list and the same data, but re-weighted it. So we put weights based on nutritional value of the foods instead of expenditures. So what we could come up with is a comparison between the traditionally reported food consumer price index and then the index re-weighted by nutrition to see the price of nutritious foods over time. The second index we came up with is the cost of a diverse diet, which is an index of the cost of meeting the minimum dietary diversity for women indicator, which has 10 food groups. The indicator is if 5 out of 10 are consumed, there's a greater likelihood of micronutrient adequacy. So this indicator goes along with the aim of many projects to improve minimum dietary diversity in showing how expensive it is to achieve that basic minimum level of diversity. So it can track price changes and volatility of all the food groups over time, as well as the cost of just meeting the minimum 5. So now I'll move on to the absolute cost indicators. The first one is the cost of nutrient adequacy. And this is a linear programming model, which takes all the essential macro and micronutrients and calculates the minimum cost of meeting adequacy for all of them. And here we have the 4 different lines are based on the pilot data we had with the Ministry of Food and Agriculture in Ghana. And it was a short time period, but it illustrates how you could use data from different regions over time to see changes in different seasons or across different regions of the country. And so the result was that to meet minimum nutrient adequacy, it would cost approximately 40 to 60 cents a day. Now, I wanted to point out here that we reran this analysis with the old data, with the food list that was missing a lot of nutrient-rich foods. And the results were much worse and could lead to wrong conclusions. So it turned out with the old data that the cost of nutrient adequacy was about 4 times what we got here. And also that the diets that came out of the model were very strange, with things like half a dozen eggs a day or something that would be unusual and very expensive to consume. So I wanted to point that out because when these estimates are made, erroneous conclusion from the old data would be that it's impossible to meet nutrient needs in an affordable way or with local foods, and maybe it would require supplementation. But actually, if you just have more foods in the data set, you see that those nutrient-rich foods show you a very different picture of the cost of nutrient adequacy. So the final indicator that I'd like to share with you is the cost of a recommended diet, which is the total cost of meeting not only nutrient needs, but food-based dietary guidelines, which are designed to provide both nutrient adequacy as well as prevention of diet-related non-communicable diseases within a culturally acceptable diet. So when this is calculated, the first question is what recommended diets are and which guidelines to use. Now, neither Ghana or Tanzania currently has food-based dietary guidelines, but we were able to use the very detailed, newly developed guidelines for Benin, which is close to Ghana, and in a similar kinds of foods and similar dietary patterns, to be able to produce this indicator for Ghana. So basically what we do is take the cost of different items in the different food groups of starches, proteins, vegetables, fruits, and dairy here to construct how much it would cost to meet the servings recommended per day. And our result was that the minimum cost of a recommended diet in Ghana is about 65 cents a day. This excludes dairy because we actually couldn't find very much. We tried to put dairy on the list, but it's really not sold in markets because it's not a very big part of diets in Ghana. So that's excluded. It would be a little bit more expensive if we had that data. But you can see here that fruits and vegetables account for more than half of the cost of a recommended diet. And you can also use this indicator to look at cost per serving. You can see that starchy staples, proteins, and vegetables are similar, but fruits is much more expensive per serving, which may be one reason why the Ghana Health Service has this huge poster on their building encouraging people to eat fruits, which is difficult for a lot of people because they tend to be expensive. So in conclusion, the indicators that we've developed and our partnerships with the government institutions in the two countries have shown that the indicators can be used for improved decision-making towards a more nutritious food system and investments in foods that are too expensive in different places and seasons. And also, we've demonstrated that existing food price monitoring systems can be used with very little added cost to provide better information for nutrition impact. Thank you.